Hi, everyone. This is Marty Burton with Personalized Nutrition Concepts. I have a very special guest today. Her name is Dr. Leila Turner. Hi, Dr. Turner. How are you?
Hello. Thank you so much for having me, Marty.
Absolutely. Would you mind just starting off and just sharing with everybody a little bit about your background?
Absolutely. I grew up in Northern California and went to naturopathic medical school, then out here in Arizona.
Mhm.
And I did a 2-year residency. The first year was in general practice. The second year was in women's medicine and hormones. And then I worked at another naturopathic office in Scottsdale for about 9 years. And then 4.5 years ago, I jumped off the cliff and started my own place. And now I have a medical center in Arcadia, Phoenix. And
Yes.
I love it. I'm there all the time, and I have a number of patients. Most of the patients I work with, we treat some sort of a hormonal disorder. Um, I'm board certified. I'm a naturopathic endocrinologist, and I love hormones, all things hormones.
Yes. And that's why you're here today. And first, I just want to let everybody know this video is for educational purposes only. Nobody's trying to diagnose, treat, cure, or mitigate disease, and always seek the advice of your individual healthcare practitioner. However, we just want to educate you so that you have more questions for your healthcare practitioner and that you can take more control over your own health. So today we're really with Dr. Turner, we're going to be really discussing thyroid and what the thyroid does and what could be the side effects of a suboptimal thyroid situation. And when getting your thyroid tested, what numbers should you know? But let's first, with clients here, Dr. Turner at PNC, I see a lot of patients that come in and I'll look at their blood work just to see where their thyroid numbers are, because as you know, that can really contribute to someone's inability to losing weight or make their health change goals that they're trying to make. So, or someone will just tell me, oh, I called my doctor, they said it was fine. And I'm
Yeah.
like, okay, great. But now I'm glad that I push further. I'm like, that's great. Can you just get your blood work? And we can just put it in your file and just make sure that you're functioning where you want to function. Again, I'm not diagnosing or treating or anything like that, but I know enough for them to ask more questions, right? So,
Absolutely.
but usually they'll come in with just one fourth of the thyroid picture, and
Right.
they'll come in with their TSH numbers, their thyroid stimulating hormone numbers. And if that falls anywhere between 0.5 and what's the range? 4.5, which is
So conventionally, it's supposed to be less than 4.5, but I do not use that reference range. Neither do you.
yeah, no, I just think that's and do you want to just take a moment, since you're
Sure.
the medical professional,
Yep.
what ranges do you look for? Because I know you're really proactive with thyroid.
Yep, absolutely. So first I always look at the symptoms. I tell people that I think the symptoms are probably like 55% of the picture, and then the lab results are probably 45% of the picture. So to me, the symptoms are more important, and the more significant the symptoms, the more stringent I might want their reference ranges to be. So TSH, for example, the conventional reference range for TSH is they want it to be less than a 4.5. And right now we'll focus mostly on hypothyroid. We could talk about hyperthyroid later if that comes up. But for hypothyroid, TSH is above a 4.5. Now, the American Endocrine Society generally wants their TSH to be less than a 3. So even when patients come in and they're at a 3.2, to me, that's way too high. And TSH, again, that's a thyroid hormone that comes from the brain and stimulates the thyroid and tells the thyroid to make hormone. So the higher the number, the more the brain is yelling at the thyroid gland, make hormone, make hormone, make hormone. And it would be doing that if there's downstream hypothyroid symptoms. So when metabolism is slow or sluggish, or you have other hypothyroid symptoms, the brain is interpreting downstairs sluggish metabolism. And so it responds by increasing TSH, which yells at the thyroid to make thyroid hormone. So the American Endocrine Society wants it less than 3. I generally like it less than about a 2, and sometimes even less than a 1.8, depending on their situation. If they're overweight, they have cold sensitivity, cold hands, cold feet, Raynaud's syndrome, where their fingers are super cold or white. There's a whole slew of other thyroid symptoms we can talk about when we get to symptoms. But for the testing, I really like TSH to be lower than that. And that's just TSH. There's a whole nother picture, which is that you can still have peripheral hypothyroid and you can even have a normal TSH.
Right. So
So
let's go back.
TSH by itself just doesn't mean much.
I know. So that brings my next question to you. Why do so many healthcare professionals or medical doctors just rely on the TSH? Why are they doing that out there in the medical community? Do you know why?
Because that's what you're taught in medical school. That's just what you're
Mm,
taught. It's very, I think in the textbooks, it's very black and white and it's very simple. And there's not this bigger picture of what else is going on. All of the lab results, well, I'll even remind my patients, we'll measure TSH and T4 and T3, but even so, I still remind my patients that the lab results are just a snapshot of what the blood is doing at that moment. The lab
right.
results don't in any way assess for peripheral thyroid function. It doesn't assess for cellular uptake of the hormone, like how well is the thyroid actually binding to the receptor? And then
Right.
how well is the receptor functioning at the cellular level? So what the labs show is really just a snapshot in time, and it's really just part of this whole thyroid conveyor belt of physiology.
Right.
So, yeah, TSH is a very small snapshot, but that's what we're taught in medical school. And that is the black and white, this equals this function. And it's
Right.
just so much bigger than that. I
It
mean,
is
your
so
food,
much.
right?
Right.
Cellular reception, if they're deficient in healthy fats, then the
Mhm.
cell membrane isn't going to work as well. And then you're not going to have that thyroid binding to the receptor as well. And there's no way for us to measure that on labs. So,
Right, that's true. And so, so say someone does go one step further and they look at free T4 and T3,
mhm.
which is great because there is a conversion factor that happens in the liver. And I do understand as a nutritionist that sometimes if the liver is so clogged up and detoxification hasn't happened, there can be a conversion error from T4 to T3, and T3, free T3 being the active thyroid hormone that regulates everything else.
Absolutely. I always measure TSH, free T4, and free T3. I love looking at the ratio of T4 getting converted to T3. And so, do you want me to go through those numbers? Give
Sure,
people some number
absolutely.
guidelines? So, T4, free T4, you generally want it to be above a 1. And then you want your T4 to generally triple into your T3. So, if your T4 is a 1, your T3 should be a 3. And if it's only a 2 or a 2.1, then they're really not efficiently converting from T4 to T3. There is a long list of things that affect thyroid conversion: high cortisol, high insulin, stress, insomnia, high carb diet, heavy metals. There's a whole list of things that will affect thyroid conversion. And
Right.
unfortunately, it's possible to know which of the issues is affecting conversion. But usually, with a really good history, you can get an idea of the possibly multiple factors affecting conversion. And then that's where you support them and treat them.
Right. So, for instance, if someone comes to you and says, I have a lot of stress in my life, I'm operating at from a scale of 1 to 5, I'm a 5 on the stress scale, that cortisol might be an issue and an indicator that could be
Yep,
negatively impacting their thyroid function.
absolutely.
So, I guess, people really want to know, well, gosh, if there's so many reasons why I could have a suboptimal thyroid situation, then where do I start? And for me, it's, a lot of it has to do with nutrition and the macronutrients and the micronutrients.
Huge. So I would say that's probably the majority of it. Sometimes they still need, if the thyroid labs are bad enough, I will still prescribe a thyroid medication. Sometimes we can do a short-term thyroid medication kind of as a band-aid to help them regenerate function. I always talk to people about my treatment approach is partly restoring function and partly replacing function. So if the thyroid is literally not functioning, if it's functioning at a 50% function,
Mm,
we probably need to replace the function a little bit while we work on restoring the function. It's
mhm.
hard to get someone to eat well and exercise well and move their body and take care of themselves if they're so depleted and so tired that they don't have the energy or motivation to cook or to go and take walks and move. So I'm
Right,
always balancing restoring function versus replacing function. And the better you restore it, the less you have to replace it.
right. And so the basic things that people can do without having to spend thousands of dollars on testing would be the obvious things like look at your nutrition. Make sure you're getting the right macronutrients and the right micronutrients. Get enough sleep. Meditate for stress or exercise for stress. Make sure that you're on a generic protocol to back up your nutrition in terms of supplementation. Can you add anything else?
That's a very good list. I mean, that's pretty much the bread and butter of helping people kind of regenerate wellness. I
Right.
think learning how to read your own labs is a really good idea. So the main thyroid labs to do would be TSH, free T3, and free T4. If there's any family history of autoimmunity, like Hashimoto's, which is the autoimmune version of hypothyroid, or if there's other autoimmune conditions like rheumatoid arthritis or ankylosing spondylitis, any autoimmune condition, they may want to also check their thyroid antibodies, because sometimes the TSH, the free T3, and the free T4 are totally normal. And we do the thyroid antibodies and we find out they have Hashimoto's.
Right.
And so in the background, there's this autoimmune going on with the thyroid, even though at that point in time, their thyroid hormones were fine. So, you can order your own labs at SonaraQuest and LabCorp. So, learning how to read your own labs and finding a doctor or finding a nutritionist like you to help people get back on track. I think
you need both.
Yep.
You need a good health team. I don't think there's one person that can solve all of the problems. I think you need, a great doctor that will go further in functional medicine and, a nutritionist as part of your team if it's in your budget.
Yep.
But yeah, I think also too, talk about Hashimoto's a little bit. The TPO antibody test is the test that determines if someone has an autoimmune disorder, Hashimoto's or something like that. A lot of times medication doesn't really treat Hashimoto's.
So once a patient finds out that they have Hashimoto's, those antibodies are generally tested once and then they're not tested again. The antibodies themselves don't really correlate with severity or prognosis of the disease. So generally doctors will only test it one time. They don't test it repeatedly to see if anything is changing. I still like to check it because I do sometimes see dietary factors change those antibodies. And there's actually two for Hashimoto's. There's the TPO antibody, topoisomerase antibody, and then there's also thyroglobulin antibody. And the TPO antibody is positive in the majority of the time in Hashimoto's. The TGA antibody is not positive as often, but it can sometimes be positive when your TPO is negative. Mm-hmm. So again, it's best to do both thyroid antibodies to make sure that there's not an autoimmune thing going on. And, 80% of our immune system is in the gut. So if there is an autoimmune thing going on with the thyroid, it usually stems back to the gut.
Everything stems back to the gut, doesn't it?
Everything stems back to the gut. Yeah,
it really does. And so and if you do have a thyroid situation and a sluggish digestive system, I've seen, and you have seen too, so many situations recently. We were just talking about the other day where you're seeing a lot of cases of SIBO, small intestinal bacterial overgrowth. And so is it true that if someone has, a thyroid situation, that's going to make their digestive system more sluggish and more time for that bacteria to build up and overgrow, causing potentially SIBO?
Absolutely. And it's kind of a chicken and egg situation because if there's overgrowth of bacteria in the intestines and they're constipated from hypothyroid, then there's going to be more overgrowth of bacteria, right. And then they're going to be more constipated. And so unless, you really need to break that cycle. And that's
right.
It's usually a combination of dietary things, lifestyle things. And then sometimes you need to be more aggressive and kill the bugs with either herbs or sometimes even an antibiotic.
Yeah. I've been, I do see a lot of, like you, I see a lot of people that have been diagnosed with SIBO from their GI doc or from their naturopathic physician. And nutritionally, I've had great success treating people with small intestinal bacterial overgrowth. And it is just about wiping out any fuel source whatsoever that can feed that bacteria. And
starve them out.
Yeah. What is the rate of people who do have SIBO? Once they get rid of it, they contract it again?
I don't know the number, but in my experience, I've been treating SIBO for a decade, and I would say that probably a third of the time it comes back. And it really has to do with people not keeping the new habits.
Right.
It just does. It's,
right.
they change their diet dramatically, everything gets better, and then 9 months later, they've kind of wiggled back into a lot of their old habits and their old dietary habits, and a lot of their symptoms come back.
Right. So for all of those people out there, if you're suffering from constipation or severe bloating or cramping, that's another reason to test your thyroid, correct?
Absolutely.
And see if that could be an underlying reason for some of these symptoms that they're having.
Yeah, the symptoms are huge with thyroid. Every single cell in your body has a receptor for the thyroid hormones. So every single cell is being directed to do its job by the thyroid hormones. So how fast do you think, your reflexes, your memory recall, your word recall, your muscular contractions, your body temperature, your blood pressure, your peristalsis of food moving through the intestines, everything you think and do and feel, even mood, anxiety and depression are both symptoms of hypothyroid. Irritability can be a symptom. Poor circulation, headaches, morning headaches is a big one.
Yeah. So don't you think, I just think this should be, how they just do general labs and the same things are always ordered. Why isn't thyroid always on that panel when someone gets their blood work done?
I wish I knew. I think TSH is generally on the panel, but as you know, the TSH by itself just doesn't show enough. And I still will look at those thyroid labs as still being only 45% of the picture. To me, like if they have all these thyroid symptoms and their thyroid labs look mostly okay, then I still am suspicious of thyroid function. It's just not overt hypothyroid that you're seeing on labs. And so then I think you have to look, is it a conversion issue? Or is it also like an adrenal or a blood sugar issue? Because blood sugar metabolism and adrenal physiology is also going to affect the thyroid.
And estrogen as well, right?
Oh, yes. The hormone
the sex hormones in themselves.
Estrogen, progesterone, and testosterone. Yep.
That's a whole nother education series. But yeah, sex hormones are extremely powerful. And as Dr. Leila just said, she specializes in that as well. And that's why I wanted to do this video with her today, is because she has come highly recommended, brilliant in her field, and deals with the things that I really want our clients here at PNC to take a look at and become educated about and address. And so not only working with me, but making sure that you get a great naturopathic physician who is really diving deep into these situations, like Dr. Turner. So real quick, I just want to touch on some of the underlying micronutrients. So our body runs on macronutrients and micronutrients, which are vitamins and minerals, and then your carb, proteins, and fats. What are some of the things that people can do with their nutrition or their micronutrients? Do you do micronutrient testing there at your facility?
I do. There's a couple of different tests you can do. Some nutrients you can test in regular blood, like you can test magnesium in a red blood cell through SonarQuest or LabCorp, but you can't test selenium. I mean, you can test selenium, but it's not a very accurate way of measuring selenium. So there is a micronutrient test that I'll do that will assess for the prior 3 months of your micronutrient storage. And I will oftentimes order that test to look at those nutrients. Selenium is super important. That's an essential cofactor nutrient for the thyroid conversion. Brazil nuts are really high in selenium. It's one of the few foods that is high enough to actually be therapeutic for the thyroid. So if I just suspect a thyroid conversion issue, then I'll use some Brazil nuts, or sometimes we'll use an actual supplement.
Yeah, 2 Brazil nuts a day can give you the required amount of selenium that you need in one day. It's amazing.
It's amazing. And they're such beautiful and delicious nuts.
They are lovely, aren't they? I know. But, so when people are trying to stay within their macronutrient requirements, I've noticed that a lot of clients will feel like, well, if this is good, then a lot more is better. And with the micronutrients, we really can't do that because they can build up in the tissues and in the brain and become very toxic to our body. So if you hear the word selenium as being great for your thyroid, or iodine, or things like that, you don't want to run out and just start mega supplementing with these micronutrients because they can be toxic. And vitamin D, I haven't seen one person who's not deficient in vitamin D, and that's an important vitamin.
Yeah.
But that's another vitamin that can also become really toxic if we over supplement.
Absolutely. All of those nutrients I'm testing pretty regularly, and then supplementing when they're deficient and holding off when they have really good levels.
Right. So yeah, you just don't want to overdo it, right? Oh,
Absolutely. All of them.
sometimes these Zoom recordings have a little bit of a delay and there's technical difficulties because of Wi-Fi, but well, great. So do you think there's anything else you would want people to know about thyroid function and what you try to educate your patients on?
I think the biggest thing is just knowing how it's a huge web. It's not this black and white. Yes, TSH is normal. My thyroid is fine. The symptoms are so much more complicated. There's, if you Google symptoms of hypothyroid, you're going to see the top 4 most common symptoms show up. But if you really dig in, there's probably about 60 symptoms that show up in hypothyroid, even menopause, which is one of my other passions to treat, is hypothyroid and menopause together. There's a huge connection and dance between all of those hormones. So
Right.
I think the biggest thing is just knowing how it all is connected. And it's also hugely connected to diet. Like you said, those macronutrients, which is why I send people to you to help them make those changes, because it's one thing to change your diet for a week or do a quick crash course. It's even, I can tell them what to eat, but it's harder you have to sit down and actually help people make those habitual changes. How long does it take to create a new habit? It's like at least
It's
30
different for
days of
everybody.
doing
Everybody,
something before
yeah, everybody learns at a different pace and everybody changes at a different pace. So it's different for everybody, but I guess 3 weeks to a month. But
Yeah.
and then people go through behavior changes and things like that they want to go back to old behaviors because of all those programs in their brain. But I just think all people need to know. First thing I just want to get across, if your doctor just looks at your TSH and says, you're fine, please don't accept that. If it requires you getting another opinion, please do that, because you do, like Dr. Turner says, you want to look at a bigger picture. You want to look at everything else as well. So just don't stop there. Don't accept that as a solution to what potentially could be, you don't feel right. You've been gaining weight, you feel sluggish, you feel tired, you have constipation, dry skin, all of these, poor circulation, you have all these symptoms, but your doctor's saying you're fine. No, you're not. It's okay to look further. So reach out to Dr. Turner. She's amazing. And that's why you need not just me, but you need someone else who can do more extensive testing and has more knowledge on the medical side of things to take care of you. So just keep pushing when you don't feel like you're getting the answers that you want.
All of the doctors at my office, we do a free 10-minute phone consult. So for anyone that's interested or they want to know maybe what would our approach be, they could give a call to the office, and we do free 10-minute phone consults. The
You
office
do?
Yep, it's livingwellnessmedicalcenter.com.
Awesome. Yes, I highly encourage you. Dr. Turner is brilliant. And like I said, if you're not getting the answers from your own physician, please call her. She's amazing. And let her help you.
Thank you, Marty. And thank you for taking care of my patients.
Absolutely. Absolutely. And we'll be continuing to work together. So I'm really looking forward to that. All right. If anyone has any questions further on this video, you can reach out to Dr. Turner or myself, and we will be happy to assist you. Have a great day.
Thank you. Bye.
Bye-bye.